Case study, dying with a stage 4 pressure ulcer. An analysis of a nursing home's gross failure to provide competent care. By Jeannie S. Kaiser-Jones, Ph.D., RN, FAAN, Renee L. Beard, Ph.D., and Tara J. Sharp, Ph.D., RN. Overview. This case study of care received by a terminally ill nursing home resident in his late 80s describes the many organizational and clinical factors that led to the progression of his pressure ulcer from stage 2 to stage 4. The patient suffered weight loss, an increase in tissue load, and deterioration of the wound, and finally died in pain with a large stage 4 pressure ulcer that was exposed in his coccyx. The authors examine the ethical aspects of the case and explore the ways in which inadequate staffing, staff education, and supervision contributed to insufficient help with meals, infrequent and improper repositioning, and unrelieved pain. "Ow, that hurts, you're hurting me. Please, just leave me alone. Please stop." These were the words of Lewis Daly, a friendly, cognitively alert African-American man in his late 80s, as nurses were changing the dressing on his stage 4 pressure ulcer 2 days before he died. This is a real patient. His name and other identifying details have been changed. In 9 months, Mr. DeLay's pressure ulcer progressed from a stage 2 to a stage 4, increasing from 1 by 1 to 0.1 centimeters in length, width, and depth to 2.52 by 2.5 centimeters by the 7th month, and 10 by 7 by 6 centimeters, with tunneling from 8 o'clock to 4 o'clock by the 8th, or in words of one certified nursing assistant, CNA, from the size of a dime to the size of a grapefruit. His entire coccyx was exposed. During this time, he lost 29 pounds, more than 20% of his body weight. Although a physician had prescribed morphine to be given orally 30 minutes prior to each dressing change, on that day, Mr. Daly had been given the analgesic less than 5 minutes before the nurses began. No one suggested waiting for the medication to take effect before starting the dressing change. How did this happen? Mr. Daly's case came to our attention while we were conducting a study on multiple factors that influence the quality of care received by terminally ill nursing home patient residents. In the course of this study, we extensively observed participants, interviewed residents, their families, physicians, and nursing staff, and observed and documented the care of the residents from the time they were identified as being terminally ill until they died. We met Mr. Daly 40 days before he died. During this period, we spoke with him and his wife and observed his care in 30 bedside visits. Mr. Daly's frail wife visited him every other day despite reporting pain in her legs that made it difficult for her to walk. As his condition declined, she tried to come daily. "I'd like to be able to see him more," she said, "but it's hard for me to get over to see him with the public transport and all. I'm not too well myself." Editor's note: the first person singular in this article refers to co-author Jeannie S. Kaiser-Jones. 9.5 months before his death, Mr. Daly was discharged from a hospital after an above-the-knee amputation of a gangrenous left foot. He was admitted to the nursing home with diagnosis of peripheral vascular disease and end-stage renal disease, with an order for hemodialysis 3 times a week. He had been in a different nursing home before his hospitalizations. Since we didn't have access to his previous records, it was unclear whether the pressure ulcer had developed at the first nursing home or the hospital. Although we didn't witness Mr. DeLay's care during the first 8 or so months of his stay at the second nursing home, we were able to observe his care closely during the final 40 days of his life. At times we felt he had no option but to step out of our role. We felt like we had no option but to step out of our roles as researchers and intervene. For more detail on ethical challenges posed by this study, see the dilemma of intervention above. Nutrition. Mr. Daly had a good appetite, enjoyed food, and preferred to feed himself. However, his hands were tremulous, and he was often in a semi-reclining position at mealtime, which made it difficult for him to eat fast. On none of his 30 visits we made was he ever in a chair. Another man, a 60-year-old who was dying of a brain tumor, wanted to go out on the sun deck. Twice I asked the staff to please let him out of bed into a wheelchair into the sun deck. They never did so. Mr. Daly and his wife said that the staff rushed him to finish his food. When he ate slowly, the CNAs shoveled the food into his mouth. Not wanting to be rushed, he would refuse to eat. Upon admission to the nursing home, Mr. Daly's medication record indicated he only had a few remaining teeth. Although his wife told the staff he didn't have dentures and needed soft food, he was kept on a regular diet for 9 months, and dentures were never obtained. During that time, he ate only the food he was able to manage with his few remaining teeth. 2 weeks before he died, he was at last placed on a puree diet. During the last month of his life, Mr. Daly became unable to feed himself. During this period, some of the staff, and one CNA in particular, fed him slowly and carefully. "He's a nice man," she said. "He's my favorite one here." Although she thought she was feeding him slowly, at one meal he cried out, "Slow down, don't rush me. I don't like to eat too fast." "I'm sorry, I didn't mean to rush you," she replied. "Just tell me when you're ready. Say ah when you're ready." After a few moments, Mr. Daly said ah, and she gave him another bite of food. He ate 85 to 90% of his food on his tray. "Great job today, Mr. Daly," said the CNA. "You did very well. See why he's my favorite? He's so nice." Mr. Daly smiled, thanked her, and said that he liked her as well. This was 1 week before he died. The CNA remarked that she had 11 residents to care for. 6 of them had to be fed. She explained that she went from room to room, feeding several residents simultaneously as not to rush them. "It's tiring running back and forth," she said, "but it's the best way for them. I wouldn't want to get all this food shoveled down my throat in 5 minutes, so why would they?" Not all of the staff were as sensitive. One CNA brought the tray into his room, placed it on the bedside table, and left. Later, he returned and scooped a large spoonful of mashed potatoes into Mr. Daly's mouth. Mr. Daly held up both his hands, indicating that was too much. He ate 2 additional small bites of food and said, "That's it." The CNA asked if he was finished eating, but before Mr. Daly could respond, the CNA began to take the tray away. We asked the CNA to leave it in case Mr. Daly was hungry later. The CNA said he would return. A few minutes later, when we asked Mr. Daly if he wanted more food, he pointed to a cup of pudding. One of us, RLB, fed him slowly, and he ate the entire cup, about 60% of the other food on his tray. The CNA never returned. When visiting one day, Mr. Daly's wife said, "If I'm here, I feed him. Then at least I know he eats. I wish I could come more often to feed him. I'd feel better knowing that he was eating and not being rushed. I wish they would spend more time with him. I never see anyone in here but to drop a tray off and ask me to feed him. I wonder what happens when I'm not here." 3 days before Mr. Daly's death, a CNA came into the room with the tray. She handed it to Mrs. Daly and said, "You feed him?" "Yes, I'll feed him," she replied. The CNA began to pour milk all over the pureed food. "No, no," Mrs. Daly cried. "Don't pour milk on that. It's to help him," the CNA replied. "He needs milk to make it easier for him to swallow." Then the CNA accidentally spilled a glass of cranberry juice all over the tray and onto the puree food. Mrs. Daly was visibly upset. She went to the bathroom to get some paper towels. When she returned, the CNA was stirring all of the food along with the cranberry juice into an unidentified pile. Mrs. Daly became angry. "I told you I'd feed him. What are you doing?" The CNA left the room. Mrs. Daly tried to separate the types of food on the plate. With each bite, she attempted to identify the food and tell Mr. Daly what she was giving him. He ate nearly all of his lunch. The pressure ulcer. When we first met Mr. Daly, his pressure ulcer had already progressed from stage 2 to stage 4. The staff were concerned. Many of them said they didn't understand how it becomes so large. One CNA said he'd been transferred to another unit for a month, and when she returned, the pressure ulcer had grown dramatically. When I last saw him, it was so small. Now it's huge. It's awful, absolutely awful. When asked how this had happened, she replied that she wasn't sure. "I don't want to say it was neglect, but I don't know what it could be." The staff nurse in charge of treatment said that Mr. Daly had diarrhea and that feces were always in the wound. She suggested this was part of the reason the wound was not healing, but the cause of diarrhea was never identified and no medication was ordered for its treatment. We were concerned, and I asked the director of nursing what she thought of Mr. Daly's condition. "He has to be off his back," she said. "He has to be on his side." However, during our visits, except on one occasion, he was correctly positioned on his left side, and several others when he was partially laying on his left side, he was always flat on his back. with the head of the bed elevated at a 30 to 90 degree angle. When I approached the administrator, who was an RN, and the director of nursing to express concern about Mr. DeLay's pressure ulcer in care, the director of nursing said, "It's just awful, and it's so painful, and it's dangerous because my glove and my gauze that used to pack the wound kept on his coccyx bone when I changed the dressing." I asked if he would like one of my colleagues, a wound care specialist, to evaluate Mr. DeLay's pressure ulcer. They agreed that this would be a good idea, and Mr. DeLay gave his consent. He was given his pain medications in time for it to take effect before she began. My colleague then debrided the wound, packed it with a saline-soaked gauze, and applied a dressing. She recommended that an enzymatic debriding agent be obtained, and the director of nurses said she would ask the physician to order it. 9 days later, when Mr. Daly died, the debriding agent still had not been obtained. The tunneling, my colleague explained to the staff, was a classic example of shearing and probably occurred because the staff were small in stature and Mr. Daly was a relatively large man, which made it difficult to reposition him. "No," the director of nursing replied. "To be honest, it's because we don't have enough staff. It's hard to get another CNA to help move him, so a CNA stands at the head of the bed and pulls him up in bed." The CNA agreed that this was so and expressed frustration, saying, "There's a charge nurse who won't help me, even to pull a patient up in bed. She'll say, 'I'm about to give these meds, I'll have to do it now.' And I have to do it now. Then you have to adjust people all by yourself, and it's very bad." On one occasion, I saw this technique in action. Mr. Daly had slipped down in bed and his leg was caught in the bedside rail. I found his CNA and asked if she could help me reposition him. However, to my amazement, she quickly went to the railing at the head of the bed and pulled him up. My colleague advised the director of nursing that Mr. Daly needed to be seen by a wound care team so a wound healing program could be put in place. The pressure ulcer could heal, she said, but it would take 2 to 3 months. We don't know whether the director of nursing told Mr. Daly's physician about my colleague's visit or her recommendation. I didn't see the physician between September 7th, the date of my colleague's visit, to examine and debride the wound, and September 16th, the day Mr. Daly died. But on September 12th, the physician wrote the following brief note on the chart to indicate that he had discussed discontinuing dialysis with the nephrologist. Mr. Daly and his family, discussions with the family, and they agreed to stop dialysis as burden outweighs benefits. On September 5th, RLB spoke with Mrs. Daly. "The doctor said we might as well take him off because it ain't doing any good," Mrs. Daly said. "The wound ain't healing," she went on. "He's just laying there without talking. I figured he'd done suffered enough. The poor man has suffered so much." Mr. Daly died 3 days after stopping dialysis. Pain. During the last weeks of Mr. Daly's life, he suffered greatly. "His pain is terrible," a CNA said. "He cried this morning when I tried to move him onto a side. He jumped and screamed when I touched him. He cries often. He has a bed sore on his back." When I asked what the sore was from, the CNA replied that he didn't know. Although the physician had prescribed an analgesic to begin 30 minutes before dressing change, it wasn't always given. 2 days before Mr. Daly's death, the treatment nurse, a CNA, and a per diem RN entered the room to change Mr. Daly's dressing. "We need some morphine for him," the treatment nurse said. The per diem nurse left the room, returned, and gave Mr. Daly the pill. 3 to 4 minutes later, they began the dressing change. "In all the years I've been doing this," the nurse said, "I have never seen any like this. There's always poo-poo in the bandage. There's nothing we can really do for him. It's so bad. All I do is try to keep it clean and dry." When he was turned on his side so he can remove the dressing, Mr. Daly screamed in pain. The treatment nurse spoke kindly. Okay, we're just going to change your bandage. Just 1 minute." The treatment nurse carefully and thoroughly cleansed the wound, packed it with gauze. Mr. Daly cried the entire time. "Ow, that hurts. You're hurting me. Please just leave me alone. Please stop." Tears were streaming down his face. After changing the dressing, they rolled Mr. Daly onto his back. The treatment nurse patted him on the arm and said, "It's okay now, we're done." When leaving the room, she said, within range of Mr. Daly's hearing, "I can't imagine he'll live much longer with a sore like that." RLB, who was observing without my supervision that day, is not a nurse, didn't feel qualified to intervene, although she attempted to comfort Mr. Daly during and after the procedure. Mr. Daly also experienced pain in the stump of his left leg. The physician had ordered oral morphine to be given every hour as needed, adjusting the dosage according to the severity of pain, but Mr. Daly's requests for medication were often ignored. As Mrs. Daly put it, "Sometimes it takes a really long time for them to come. Mr. Daly died at 12:15 p.m. on the 16th